Hello, I'm Juliana Liu. My current project at HERC involves evaluating the cost-effectiveness of novel interventions in reducing events risk in well-managed patients with prior cardiovascular disease. People with atherosclerotic vascular disease remain at high risk of cardiovascular events despite effective risk factor management. Novel interventions are being developed to target this risk population subgroup. Our team is interested in evaluating the cost-effectiveness of these new drugs in reducing residual risk in a well-managed population through a patient-level simulation model. We model based on the data collected in the review trial. It is an international randomized controlled trial with 30,449 participants with existing atherosclerotic vascular disease, aged 50 years old or above, and on existing atorvastatin therapy. Throughout the 4-year follow-up trial, participants receive a treatment of either 100 micrograms of Anacetrapib daily or a matching placebo. We have included 10 common key adverse events endpoints of interest in the latest CVD drug clinical trials in our model, namely myocardial infarction, non-hemorrhagic stroke, coronary revascularization urgent, non-urgent, heart failure, insulin cancer, insulin diabetes, non-coronary revascularization, cardiovascular death, and non-cardiovascular death. To develop the long-term CVD patient-level simulation model, we first built risk equations based on revealed trial data. We are interested in the first occurrence of the 10 vascular or non-vascular adverse events of interest introduced earlier. Then we develop annual hospital cost and quality of life regression models based on UK or US health systems perspective, followed by an external validation and calibration of our model utilizing UK Biobank participant data. The advantage of using UK Biobank data is that they have a longer follow-up data of 10 years versus 4 years in review trial. Finally, our developed long-term CVD patient-level simulation model can be used to assess long-term effects and cost-effectiveness of new CVD treatments such as PCSK9 inhibitors for different individual risk profiles. This piece of work is done collaboratively with all the wonderful people listed here: Bobby, Alistair, Claire, and Mijun from HERC, and Professor Martin Landry, Louis Bowman, and Gemma Hopwell from the CTSU unit, on behalf of the HPS3 TIMI55 Reveal collaborative group. Thank you for listening. If you're interested in our project, feel free to email me.